Fran, I want to wish you all a Merry Christmas and a joyous holiday season. A lot of activity going around the state today as we're seeing more and more people who are vaccinated. Very exciting to see this. We're first going to go to Lake County. Advanced EMTs and paramedic administer medical shots on a regular basis, but during a public health emergency, they can also be called on to do extra manpower to give these vaccines. This year, they've been helping to administer flu vaccines, and now they're able to administer the COVID-19 vaccine when working in coordination with their local EMS medical director in a local health department or a medical provider. So we'll go to Lake County, and that's where Dr. Carol Cunningham, an emergency room physician and Ohio State's medical director for emergency medical services, will be getting her vaccine from Dan Sampf, a paramedic with Kirtland Fire Department. How y'all doing?
Oh, we're doing great. Thank you for having this opportunity to give a strong message to Ohio EMS providers as well as all healthcare workers to obtain this vaccine. As the numbers have shown, our healthcare system has been stressed, and of course, EMS calls have gone up. Many of our EMS agencies have been strained due to loss of manpower, secondary to people becoming ill and unable to work, yet the needs are increasing. Unfortunately, our first fatality due to COVID-19 in Lake County was actually one of our EMS providers.
Oh, wow.
Yes, and then, this is an opportunity for a change. Wearing face masks and social distancing have really helped quell some of the rise, but now we have a safe and effective way to actually prevent this disease with a vaccine. So I would encourage all of EMS providers and health workers to go ahead and obtain that vaccine for a couple of reasons. Number one, we need to be going out and vaccinating the public. We are a critical part of the manpower that are going to help save lives with this vaccine. And second of all, it's safe. In order for us to protect and be able to do this, we need to make sure that we have our manpower up. You can have 1,000 ambulances, but they're nothing without the people in them, the caregivers in them. So I would say that the other benefit is we all have to go home to families. What better way to protect others and to protect your own family members by taking the vaccine and actually preventing the disease, period. So, EMS is one of those medical fields, it's a team sport. So I have my team here with me, and it's a situation that's all hands on deck.
Well, that's great. Dan, how are you today?
I'm doing very well, sir. Thank you very much for asking.
And who else is there, and what are you holding?
Dominic Velo with the Mentor Fire Department, and I have Dr. Cunningham's favorite person here is Maynard.
What's the name?
Maynard.
It's okay. I live by myself, so this has been my companion while social distancing, and he's one of our favorite, he's part of the teams.
Awesome. Well, Doctor, are you ready to get the vaccine? Dan,
I am.
You guys ready to go?
Yes, sir.
Let's do it.
Okay.
This is the only thing I want for Christmas, because health is well.
Well, you're dressed appropriately. You got the right colors on today, huh? Christmas season.
Merry Christmas. And red is for 911 too, so. All right. That didn't hurt a bit.
All right. Look like you're doing okay, Doctor.
Oh, I'm doing great. I can't wait to get the second dose. I hope everybody goes out there and gets the vaccine so we can get back to live baseball and live music and having a normal summer.
I'm for all those things, Doctor. Absolutely. Well, we appreciate it. Thank you. Have a good day, everybody.
Thank you.
So we're going to go to Clark County next. This week, Moderna's COVID-19 vaccine started arriving, and it's arriving all over the state of Ohio. at local health departments and also at hospitals. Throughout the pandemic, we've really relied on our public health teams, and they've done so much with the tracing and all the other things they're doing because of the pandemic, in addition to what they do each and every day to keep us all safe. We're once again turning to these public health departments, 113 around the state of Ohio. They're really experts at managing mass vaccination clinics, whether that is for the seasonal flu or H1N1 pandemic. And I'm just thankful that we can turn to them to begin vaccinating Ohioans. And so we have health departments all over the state now who have started doing this. So today we're joined by Christina Conover. Christina she's somewhere there, I think, maybe off screen. We recognize you. We know you. Good to see you. Christina is the Director of Nursing for the Clark County Combined Health District. Christina, you all started, I think, yesterday. Tell us about how yesterday went.
Yes, yesterday was really a great day. We, as Public Health Department, are really excited about the opportunity to be part of this phase of the response. We have a great team. We also have a great team locally, a lot of partners who have made this possible. We have, just a great space to do this in, and none of that is because any one agency is working alone. So really excited to keep going. We hope to be able to be a large part of the vaccine response, going forward as well. And
well, that's great.
The flexibility.
Well, with you is Chris Shilton, a paramedic and firefighter from Springfield Fire and Rescue. How are you doing?
Good. How about yourself?
Well, good. How many years you been on the fire department?
I was 23 years in November.
23. You've seen a lot then.
Yes, sir. We've been seeing a lot all day today.
Yeah. Well, tell us a little bit. You don't have anything to say to the people of Clark County and the area, and we just appreciate you for what you do every day and appreciate you being here.
Well, I appreciate you having me. If anybody knows me, I'm a champion for the city of Springfield, but specifically in this instance, I'd like to be a champion for the Black community. I understand the history of, vaccines in our community specifically.
Sure.
But I believe in this vaccine. I believe this is the time to do something like this. I've got my selfish reasons. I'm a 40-year-old Black male who's a little overweight. And so I'm in that disproportionately affected group. My parents are 73 years old. My kids would like to go back to school full time. My son plays basketball. My wife's a nurse. I've got an aunt who's currently on a ventilator in the hospital right now.
Oh, ooh.
Got all kinds of business people that I associate with that are suffering, people who are unemployed or underemployed right now. And beyond that, there are thousands of people that are dying every day. So I like to do my part to get us back to close to normal if I can, do my small part.
Well, you've articulated a lot of reasons. Thank you very much.
Yes, sir. Thank you.
You ready to get the shot?
No, not really, but
All right, Christina, you're on. So where are you guys right now? What am I looking at?
J.C. Penney's, and it used to be the Upper Valley Mall.
Sure. I don't know. You got some pretty good muscles there. You've been doing working out.
My dad gave them to me. Genetics. Ouch.
How we doing?
Good. Didn't hurt too bad. She's really good at this.
Well, we thank both of you very, very much and hope you have a blessed Christmas. And we just appreciate you being with us today. And thanks for what you both do to keep us all safe.
Thank you. And thanks for having me be a part of this. Thank you.
Thank you. Appreciate it. We're going to go to Tuscarawas County. Go to the health department, Dover, where they're vaccinating their emergency department physicians today and tomorrow. Next week, they will start vaccinating EMS first responders. Today, we're going to see 2 emergency room doctors get shots there today. We've got Dr. Kevin Miller, who in addition to being an emergency physician is chief of the Sugar Creek Fire Department. Hey, Chief, good to see you. And also the county EMS director. Also Dr. Jeffrey Cameron, who is also the Tuscarawas County coroner and emergency room doctor. thank you both for joining us. We
Welcome.
appreciate it. How y'all doing today?
Good. We're excited.
That's good. Well, you've probably, seen a lot of COVID patients. You've been treating directly COVID patients in the last few months, I assume?
Lots of COVID patients every day.
Every day.
Probably 50% of our patients
Wow. Wow.
at a minimum.
Oh, boy. Well, are you, one of the things that we hear, and we see some things on the internet about the vaccines and some of the myths about the vaccines. I wonder if you have any thoughts about that. Obviously, you're getting these shots today and you're, emergency room physicians.
So the way that I think about it is the world is sick right now. And the medicines that we prescribe to patients when they come in the hospital and they're already sick, we're grasping at straws with those treatments. They're not shown to change the outcomes for our patients, but it's what we have. Once you have the virus, how it's going to play out in your body is how it's going to play out. This vaccine is the cure. We have the cure in our hands. We all need to take part. We all need to work together and get vaccinated. Granted, obviously it's rationed right now, but as it becomes available, every one of us needs to do our role so that we can make the world healthy again.
All right. Y'all ready to get the shot?
Yes, we're ready.
So we have Amy Kaiser, who's going to give you both your shots now. And she's not messing around. She's moving. Okay. She was ready.
Quick and painless.
Looks like she's done this before. What do you think?
We've been looking forward to this for months and months.
This is one of the best Christmas gifts we could have asked for.
Well, we appreciate everything you're doing. And, we've been anxious, obviously. I know you have been, to be protected. So just thank you for what you do every day.
I would echo what Dr. Miller said. This is the cure. This is what's going to make the difference for the future.
Yeah, it changes the future. Oh. Well, we thank you all. Thank you very much. Good to be
Thank
with
you very
you,
much.
and good luck. And thanks again for all three of you for your fine work. Appreciate it very much.
Thank you.
Thank you. We're now going to go to Twin Valley Psychiatric Hospital. Another part of our 1A process is making vaccinations available to those at state psychiatric hospitals who choose to receive them. The congregate nature of those facilities makes those that live and work there vulnerable to spread. It's a congregate setting. A Twin Valley Behavioral Health Care Hospital received vaccines yesterday. They're continuing the process of vaccinating staff and high-risk residents today and tomorrow. And with us is Charles Shepard, a therapeutic program worker at the hospital, who is choosing to be vaccinated. Good to be with you.
Well, thank you, Governor.
How many years have you been there?
I've been here at Twin Valley for 10 years.
That is great, and we appreciate your good work. Unfortunately, COVID-19 is certainly widespread, and we always worry about it getting into any congregate care setting, like you have there as well. You have any thoughts about this? Are you ready to go?
Yes, sir. Well, first of all, I'd like to say it is an honor. It's a privilege, and I feel grateful to have this opportunity, to make the world a better place right now. This situation with COVID has been something I've dealt with personally, because I have two children that were stricken with this illness.
Really?
One of my children was actually placed in a coma for 3 weeks, and she is currently still in the nursing facility. And my other daughter, she's getting better very slowly. And I would just like to say to anybody that has any concerns or worries about this, you owe it to everybody. You owe it to everybody you love, everybody you care for, everybody you work with, and everybody you take care of to get this vaccination. You know, we need to get life back to the way it was. And with this is the way we can make it possible.
Well, I wish your children the best. I wish you the best. You've been through quite a bit. That's very tough. Thank you for your statement, and thank you for doing this. This is really the day we've been waiting for. Let me introduce Abby Hunter, who's going to administer your vaccine. Abby, how are you today?
Doing well, thank you.
You've given a few shots, have you?
A couple, just a couple.
You ready to go?
I'm ready.
All right, let's do it then.
You ready?
Well, thank you both very, very much, and good luck. You doing okay?
Thank you. Yes.
Thank you very much. Hope you have a good Christmas.
Thank
Thank
you.
you both of you.